know that neglecting one simple habit could double your risk of erectile dysfunction after age 60 without you even realizing it? Every day, thousands of older men quietly lose sensitivity, strength, and confidence, all because no one warned them how to take care of one of the most important parts of their body, their penis. Hi, I'm Dr. James, board-certified urologist and men's health specialist. After more than 30 years of treating aging men, I've seen firsthand the struggles seniors face, many of which could have been avoided with just a few simple changes. Most people think penis health is only about sex. But what if I told you that the way you care for it actually affects your circulation, sleep, and even your confidence as a man? Today, I'll show you 4 essential care tips every man over 60 must follow to preserve not only their performance, but also their quality of life. These are science-backed, practical steps you can start today. No pills, no procedures. And if you stay until the end, I'll reveal 2 bonus habits that most men have never heard of, but they may be the missing link to protecting your vitality for years to come. Before we continue, make sure to hit that subscribe button and turn on the bell icon, so you never miss another essential men's health tip designed to keep you strong, confident, and informed after 60. If you find this video helpful, type 1 in the comments to show your support. If not, type 0 and let me know how I can improve future content for you. Now let's begin with the first and perhaps most overlooked pillar of penis care after 60, keeping it active. Because believe it or not, just like your muscles or your memory, if you stop using it, you start losing it. 1. Keep it active or risk losing function. One of the most common mistakes I see older men make is assuming that their sexual health naturally declines with age and that there's nothing they can do about it. But that's not the truth. In fact, the real tragedy isn't aging itself, it's disuse. Just like your legs will weaken if you stop walking, your penis also loses strength, flexibility, and sensitivity if it's not regularly stimulated. And I'm not just talking about sex, I'm talking about blood flow, about oxygenation, about keeping tissue healthy and responsive. I've treated men in their 70s and even 80s who were frustrated by sudden changes in their performance, only to find that they had unintentionally stopped engaging with their own body. The truth is, if you don't maintain regular erections, whether through intimacy, gentle self-stimulation, or even non-invasive tools like a vacuum erection device, you risk losing the vital elasticity and function of this delicate organ. Erections aren't just about pleasure. They're your body's way of maintaining circulation to one of the smallest and most easily damaged arteries in the body. When you keep your penis active, you're not just preserving your sexual performance, you're also protecting your confidence, your sense of masculinity, and your connection with your partner. It's a form of self-respect. It's also a signal to your brain and your body that you still care about your health and that you're still very much alive. The men who take this advice seriously often come back months later with a quiet smile and a newfound energy in their step. They feel like themselves again, not because of a miracle drug, but because they re-engaged with their own biology. So if you've fallen into a habit of neglect, I urge you to start gently. You don't need to force anything. Just stimulate regular blood flow, keep the connection alive, and watch how your body begins to respond in kind. Now that's just the beginning, because even the healthiest habit can be undone by a silent threat that hides in plain sight, and it's something many men ignore until it's too late. Let's talk about that next. If you're still here and these tips are resonating with you, drop a number 1 in the comments to let me know you're taking charge of your health. Now let's keep going. What comes next might be the most overlooked step of all. 2. Prioritize hygiene. It's more than just cleanliness. I can't tell you how many times I've sat across from a man in his 60s or 70s who looked me in the eye and said, "Doc, no one ever told me this stuff mattered." And the truth is, most men were never taught that proper penile hygiene is about far more than just smelling clean. It's about protecting one of the most sensitive and vulnerable parts of your body from long-term harm. After 60, your skin becomes thinner, your immune defenses start to decline, and your body doesn't recover as quickly from irritation or infection. That means a lazy approach to hygiene, especially in the groin area, can become a hidden gateway to serious problems. What kind of problems? Chronic inflammation, painful infections, even penile cancer in extreme cases. I know that sounds alarming, and it should. In fact, poor hygiene is one of the leading causes of penile cancer in older men. When sweat, dead skin cells, and natural oils build up, particularly under the foreskin, it creates a breeding ground for bacteria and fungi. You might not notice it at first, maybe a little redness, a little irritation. But over time, those small signs can grow into something dangerous. The solution, however, is simple and powerful. Daily washing with a gentle, fragrance-free soap like glycerin can protect your skin, preserve your natural balance of bacteria, and keep inflammation at bay. Always dry the area thoroughly, especially after a shower or intimate contact. And if you're still sexually active, make it a habit to wash after intercourse. Why? Because the vaginal environment has a different pH, and mixing it with yours without cleaning up can trigger shifts in your body's natural defenses. These shifts often go unnoticed, but they silently disrupt the harmony your body depends on. When you care for your hygiene, you're not just protecting your health, you're restoring confidence. There's something deeply empowering about knowing your body is clean, healthy, and cared for. It's a quiet act of self-respect that pays off in how you feel and how you show up in your relationships. But even the cleanest, most well-maintained body can fall victim to a mistake most men don't even realize they're making until it leads to something far more painful than they imagined. And that's what we'll uncover next. 3. Avoid sex with a semi-erect penis. Protect it from internal injury. This is one of those lessons that far too many men learn the hard way, and by then, the damage is often already done. I've had older patients come into my office worried about a bend in their penis they'd never noticed before, or discomfort during intimacy they couldn't explain. After a thorough evaluation, it often traces back to something surprisingly common but rarely talked about: having sex while only partially erect. You see, a penis that's not fully firm is structurally vulnerable. The tissue is caught somewhere between soft and rigid, and when it's pushed or bent in that state, especially during penetration, it's prone to what we call microtraumas. These are tiny internal injuries you can't see and often don't even feel in the moment. But over time, they add up. The scar tissue they leave behind can lead to Peyronie's disease, a condition that causes curvature, pain, and in some cases, makes intimacy difficult or even impossible. Now, most men don't realize this because the shift doesn't happen overnight. It creeps in slowly, a little stiffness lost here, a curve starting to form there. But when you're over 60, your body's ability to heal isn't what it used to be, and what might have been minor at 30 can become a serious issue now. That's why I tell my patients this: listen to your body, don't rush the moment. If you're not fully ready, physically or emotionally, it's okay to wait, to breathe, to let your body catch up. There is nothing unmanly about pacing yourself. In fact, it's a sign of wisdom. There's also nothing wrong with using help if needed. Lubrication can reduce strain, and open communication with your partner about what feels right can prevent situations that lead to injury. Intimacy after 60 should be more about connection than performance. When you approach it with care, it becomes safer, richer, and far more satisfying. But even if you avoid this mistake, there's another hidden risk that's quietly stealing your strength, not from your body, but from your mind. It's a modern habit that's rewiring how men relate to their own desires, and it's what we need to explore next. If you're still watching and these insights are making a difference for you, type number 1 in the comments to let me know you're tuned in. Now let's move forward to point number 4. It's one that could quietly be affecting your confidence more than you realize. 4. Limit porn use, rebuild real connection. This might be a sensitive topic, but it's one that deserves to be talked about, especially among men over 60. I've met countless men who quietly admitted that they spend more time watching adult content than they ever intended, and they're not proud of it. They often say things like, "It's easier," or "It helps me relax." But what they don't always realize is that over time, this habit can chip away at the very foundation of their sexual health and their ability to connect with others. As we age, our brains and bodies change. What once excited us easily may now require more stimulation. And when you rely heavily on pornography, your brain adapts to it. It begins to associate arousal with fantasy, not reality. Slowly, real-life intimacy may start to feel less thrilling, less satisfying. That spark you used to feel with your partner can dim, not because the connection is gone, but because your brain has been trained to expect something else. Something more extreme, something artificial. The saddest part? Most men don't even see it happening. They just notice that it takes longer to get aroused, that their body isn't responding the way it used to, that being close to someone no longer ignites that same fire. I've seen this play out time and time again, and while it's nothing to be ashamed of, it is something worth facing. When you begin to cut back on porn, even just a little, something powerful starts to happen. You rediscover sensitivity. You start to appreciate touch again, real human connection. Your imagination returns, and with it, your confidence and sense of self. It's not about quitting cold turkey or judging yourself. It's about giving your mind and body the space to reconnect. Especially after 60, when so many parts of life are changing, this kind of reconnection can be deeply healing. You start to feel present again, alive again. Intimacy becomes less about performance and more about presence, more about you. But even if you've mastered your habits and your mindset, there's one final piece of the puzzle that many men overlook. It's not about what you do during the day, it's about how you sleep at night, and that's where our first bonus tip comes in. Bonus tip 1, change how you sleep. It's easy to overlook the small things, especially when they've been part of your routine for decades. But sometimes it's the smallest habits that quietly do the most damage, and for many older men, the way they sleep falls into that category. I've had men in their 60s and 70s come to me complaining about discomfort, sensitivity changes, or even curvature in their penis that seem to come out of nowhere. And when we dig into their lifestyle, one hidden detail often comes up. They sleep in tight underwear. Now, I know that might sound trivial at first. What difference could a pair of briefs make, right? But here's what most men don't realize. During sleep, your body goes through natural cycles of arousal. These nighttime erections aren't about dreams or desire. They're your body's way of maintaining healthy blood flow and tissue elasticity. But if your penis is being squeezed, bent, or restricted by tight fabric while this is happening, it can lead to repeated trauma over time. That trauma creates scar tissue, and scar tissue can lead to Peyronie's disease, painful erections, and long-term curvature. When I explain this to patients, there's often a moment of silence, followed by a quiet sense of surprise. Because it's such a simple fix. Just change what you wear to bed. Or better yet, don't wear anything at all. Give your body the freedom to move naturally at night without restriction. Let those nighttime erections do their job without interference. It's a small shift, but it can protect your health in a very big way. And what's more, many men tell me they sleep better this way. Less tossing and turning, less discomfort, more restful nights. It's a form of self-care that no one talks about. But once you try it, you wonder why you didn't start sooner. But even if you've changed how you sleep, there's still one final tip that ties everything together. Something that affects every part of your body, including your sexual health. It's not about a routine or a product, it's about your entire lifestyle. And trust me, this next one might be the most powerful of all. Bonus tip 2, your lifestyle is the root of sexual health. I've said this to countless patients over the years, and I'll say it again here because it's that important. You can't separate your sexual health from the rest of your life. It's all connected. I've seen men try every supplement on the shelf, chase miracle cures, even undergo procedures, yet they ignore the most powerful medicine available to them, their daily habits. And the truth is, after 60, your lifestyle isn't just a background factor. It becomes the foundation for everything, especially your ability to feel strong, vital, and connected. The penis is a vascular organ, which means its performance depends entirely on healthy blood flow. And the first signs of poor circulation often show up here before they show up in your heart or brain. That's why erectile dysfunction isn't just about sex. It's often the early warning sign of a deeper problem. A poor diet, lack of movement, too much alcohol, chronic stress, or years of smoking, all of these things slowly chip away at the vascular system, narrowing arteries and weakening function, often without obvious symptoms until it's too late. But here's the part that gives me hope. It can be reversed. I've watched men in their 70s completely transform their sexual health just by transforming their lifestyle. It doesn't take perfection. It takes consistency. Walk every day, even if just around the block. Eat real food, fresh greens, healthy fats, clean proteins. Stay hydrated. Prioritize sleep. Breathe deeply. Let go of toxic stress. And most importantly, believe that your body still wants to work for you. It just needs you to work with it. When you treat your lifestyle as medicine, everything else improves. Your energy, your mood, your intimacy, your confidence. You stop feeling like life is shrinking around you and start feeling like you've still got so much living left to do. Now, if you've followed me this far, you've already taken the first and most important step, awareness. But don't stop here. Because in just a moment, I'll bring everything we've learned together in one final message. Something deeply personal and something I believe every man over 60 needs to hear before it's too late. A better future starts with simple care. If you've made it this far, I want to say something from the heart. Thank you. Not just for listening, but for being willing to face a topic that most men would rather avoid. That takes courage. That shows a level of self-respect that too many people underestimate in older men, and I want you to remember something important. Taking care of your penis after 60 isn't about vanity, and it certainly isn't about chasing youth. It's about maintaining connection, preserving confidence, and protecting the part of you that still wants to feel alive, valued, and whole. Let's take a moment to reflect on what we've covered. Keeping it active isn't just about sex. It's about keeping the blood flowing, the tissues oxygenated, and your sense of identity intact. Prioritizing hygiene is a simple, dignified act of respect for your body that prevents problems no man wants to face later. Avoiding sex with a semi-erect penis may sound like a small detail, but it can save you from years of pain and frustration. And cutting back on porn, that's about reclaiming your ability to truly connect with yourself and with a partner. Then we talked about sleep, how even something as minor as tight underwear can create long-term damage if we're not careful. And finally, we looked at the truth behind it all. Your lifestyle, what you eat, how you move, how you breathe, it all matters. These choices aren't just about extending life. They're about making the years ahead fuller, stronger, and more meaningful. I've worked with men in their 60s, 70s, and even 80s who felt like their best days were behind them until they took back control of their health. And I can tell you firsthand, it's never too late to make a change. You don't have to overhaul your life overnight. You just have to start. One step, one habit, one better choice. Because the quality of your life tomorrow depends on what you choose to do today. And your body, your mind, your relationships, they're all still listening. So speak to them with care. They're waiting for you to show up. And now, you finally know how. If this message spoke to you, don't just keep it to yourself. Share it with another man who needs to hear it. And if you're ready to take control of your health, hit that subscribe button so we can keep walking this journey together.